Hello everyone, myself Dr. Aditya Gupta. So this video is particularly for everyone who's going to join residency, especially who are planning to join a residency in pediatrics, be it either MD in pediatrics or a DNB in pediatrics. So what you should remember, what are my experiences from my 3-year residency in pediatrics, along with what I've learned from Divya's experiences in the past 2 years. What are the things that you should remember while doing your residency in pediatrics? And this obviously is valid. Some points are obviously valid for residency in any medical field, be it your medicine, be it your derma, be it your radio, for that matter of fact. So the first year is going to be help. Be prepared for it. First year is almost going to be that you will be having very hectic duties. You will be working for 12 to 14 hours almost on a daily basis, without any Sunday, without any Saturday. Okay, there will be very few or almost nil holidays, if that be the case. If you're prepared in the very beginning that yes, first is going to be hell, it's going to pass much easier actually. If you rather go with thinking, oh my god, residency is going to be like, it's going to be like MBBS or something on those lines, you are in for a rude shock. First year will be hell, there's no doubt about that. Pediatrics as compared to other fields is slightly different in a way that while the hierarchy does exist, and as you grow, as you become second year or a third year, the amount of work probably reduces a bit, but the responsibility rises a lot. Basically what happens is in the first year there will many things won't be there will be many things which you won't be allowed to do, or which you would be doing only under supervision, because they it's children obviously, so they don't expect you to know many things about them, their physiology, their dosages and stuff like that. So you will always be supervised by your senior, or sometimes even senior will be doing those things and you won't be doing those things. So in this manner, actually sometimes the work actually increases with each passing year in pediatrics, or the responsibility increases with each passing year in pediatrics. And when you become second year and third year, there will be certain things which you probably were let go of in your first year, which you won't be let go of in second and third year. And in this way, sometimes I've felt that in AIMS there is absolutely no hierarchy. In other colleges, from what I've also heard, let's say in Safdarjung, that the hierarchy actually sort of reverse. Second and third year probably are doing more work as compared to a first year, but first year will be hell. Let me be very clear about this. The second thing, which is pretty much valid for any residency in our country, senior is always right, junior is always wrong. It's a wrong trend. There's a lot of toxicity. I would agree to that. Let me tell you something. Workload is not toxicity. Toxicity is when your senior is being rude to you, his senior is being a jerk to you, is being a dick to you, simply because he can. He's trying to make your life hell simply because he can or she can. That is what is toxicity in my opinion. Workload is never toxicity. If your seniors are good, if they are jovial, if they're kind, you can work for 20 hours in a day. But if there are people who point out every mistake of yours, pointing out mistake is still fine, but penalizing you for every small mistake of yours, being late by 1 minute or being late by 2 minutes, making you these are the things which make working environment toxic. That's what I mean to say. Workload, by the way, is never toxicity. So I'll say that you just get through with it. I mean, there's no work around it. You really don't have to fight it. You cannot change the system, but you can be the change later. That's all I will advise to you, that that it's okay if your seniors are being dick to you, or if your seniors are being jerks to you. Just, they're always right, you're always wrong, say sorry, move on, learn, whatever it is. But when you become second year, or when you become your third year, don't try to emulate them. Be a better person, be more kind. So one thing that I have adopted since I have become a senior resident is that I do not try to leave before my junior resident leaves. Even if it involves me staying for 1 hour or 1.5 hour extra, I do try to do that. Obviously, there are times when I fail. I understand that there might not be any work for me as a senior resident. It's just that there are some discharges that are left, and the junior resident is typing them. But the simple fact that I'm staying with them makes many things easier. I can explain to the patients the discharge advices, or if he's having I can check the discharge properly and stuff like that. A very brief small example, maybe I can sample, even as a senior resident, I can, there's no harm in me sampling. If there is a problem with there is a lot of workload, suddenly too many patients have come from emergency, and he cannot sample everything. It's fine if I sample for 3 to 4 patients. For me, sampling 2-3 patients is not going to make a difference to my life. I don't become smaller because I sampled a patient despite being a senior resident. But for him, suddenly the workload will suddenly decrease. So you can be the change. You don't have to be a dick when you become a second and third year. You don't have to be like कि हमने सहा था तो हम भी तुम्हारे साथ ऐसा करेंगे. Please try to be the change, and only then can our medical education progress. Second advice, you don't need to buy the books in first year. I'll be very, very blunt. This is one advice that I should have gotten. I did not, because Nelson will change every third or fourth year. So Nelson last changed in 2020. So if you buy it right now, in the next year in 2024, Nelson will change. So you again have to buy new Nelson. And this is a mistake that I did. I essentially wasted my 4,000 rupees in buying the Nelson. Rather, you can download the free PDF or available over Telegram or available over, on torrent or whatever it is. But don't buy Nelson right now or PG textbook or pediatrics right now, because the edition is definitely going to change. I'm 100% sure about that. So don't buy Nelson in your first year. So the two books that I'll actually recommend buying in the first year itself are this PICU Protocols and NICU Protocols of AIMS. Whenever you are dealing with any emergency, or whenever you're posted in your NICU, whenever you're posted in an intensive care unit, you can actually go through protocols and they will stay in your mind for long. Always carry your Harriet Lane or drug dosages books, because we have been accustomed to giving drugs to adults, Augmentin 625 mg TDS, or your antihypertensive drugs, be it your hydrochlorothiazide, or be it glimepiride or something like that, like a fixed dose as far as adults are concerned. But pediatrics is different. Doses are based on their weight. It's per kg, and we have absolutely jack shit idea. So always carry your drug dosages book either in your mobile phone, as in the form of an app, or a Harriet Lane with you, so that you don't have to keep on asking around. You just look up for it and prescribe the dose. Another thing, you should definitely not neglect your thesis. This is a mistake which I find a lot of people doing. Don't neglect your thesis. Your thesis is your first entry into the world of medical research. It's fine if you don't like it, that's perfectly fine, but get done with your thesis, and your thesis is something which you will always be proud of. So don't neglect your thesis. End of second year, the DM, if you want to prepare for DM, is something that's what you desire. I think end of second year, after your 1.5 years have passed, you should decide which thing you are liking the most right now, and then you can probably start preparing for DM. But don't, unlike the trend that has been now in case of MBBS, ki pehle saal se NEET PG. Remember, you're not a aspirant, you're becoming a doctor. You're not a NEET PG aspirant, you are a doctor. I don't know why people keep on forgetting that when you're in first or second year, you're not preparing for NEET PG, you're preparing to become a doctor. Unfortunately, the system has a system, thanks to us YouTubers, I guess, who keep on shoving down apps down your throat, has become something like, if in your first year, you're no longer a first year medical student who's trying to become a doctor, who's trying to perfect biochemistry or physiology. You have become a NEET PG aspirants. Apps are to be blamed for that. Apps are to be blamed for the FOMO that they have created. My fellow YouTubers are to be blamed for that, frankly. But whatever it is, that's the reality, whatever it is. But in your residency, please don't neglect books. You have to read Nelson. At least parts of Nelson you definitely have to read. You definitely have to read, if you are not someone who likes Nelson, you can actually go for PG textbook of pediatrics. That is something like Hirschman versus Nobbins. Obviously, I'll say Nelson is a better book, but you can obviously go for PG textbook of pediatric. Don't neglect your books. There's life outside residency. Try to take breaks, go outside, even if you're getting free at 9 o'clock or 9:30 or 10 o'clock, maybe, and tomorrow you again have to come at 7 o'clock in the morning or 7:30 in the morning. Go to a club, party hard, get a life outside residency. Try to go for vacation, try to explore your hobbies, especially in the second and third year, when when you will be probably having a much more free time. There's in fact another thing that I wanted to emphasize, that the word doctor itself means being a teacher. So teach. Remember your internship, remember your first year when you become a second year, that you always love that resident, you always love that doctor who used to teach you a lot. We by definition are nerds, we love to learn. So be that teacher. If you are making your intern work, be sure to teach them something every day. Even if they are taking a small sample for you, tell them why you're making them do that CVC, why you're making them do that particular test, why you're asking them to do something. So teach. I think teaching is the best way to learn as well. This is one of the reasons I think I have grown a lot. I used to teach Divya a lot when she was a non-acad GR here. That helped me both, academically and, in love life, I'll say. So get into the habit of teaching. So that's about it. These are the things I think you should remember before going into your pediatric residency. Thank you. Have a nice day.